The transverse abdominis, or TVA breath exercise, is designed to keep pregnant women's deep core muscles active while they're expecting. As your belly grows during pregnancy, it may seem counterintuitive to work on strengthening the muscles around this area. However, the TVA breath is excellent for core and pelvic floor strength, mastering control of breath work, eliminating low back and pelvic pain, preventing abdominal separation, and healing separation post-pregnancy. The core is made up of the pelvic floor, the diaphragm, which is the muscle that controls your breathing, the multifidus, the deep spinal muscles, and the transversus abdominis muscles, which are the deepest abdominal muscles. It encircles your trunk like a corset. You might have felt it involuntarily contract when you sneeze. The fibers act just like a corset, pulling the core in from all angles, front and back, which compresses the abdominal cavity and helps you push during labor. The pelvic floor and transversus abdominis keep your belly from dropping to your toes and, together with the uterus, work to push your baby out during delivery. Training those muscles to be as strong and flexible as possible will assist in an easier labor. Did you know that incorrect intra-abdominal pressure throughout your pregnancy or after can increase your chances of having diastasis recti, pelvic floor prolapse, and incontinence? The stronger you can get your pelvic floor muscles, the more comfortable you will be pre-delivery, during delivery, and post-delivery. As you activate your pelvic floor and transverse abdominis muscles, together with the core breath, you give your baby a gentle hug, which creates a contraction between the pelvic floor and deep core muscles, and lifts and activates the pelvic floor. The baby is completely safe with this move. The baby simply slides up into the ribcage during the core activation. The reason the belly gets smaller is not because you're sucking it in or drawing your belly button to your spine, but because you are activating your inner core unit, inhaling with the diaphragm as the belly gets bigger, then lifting through the pelvic floor and wrapping the transverse abdominal muscles on the exhale. Those deep breaths cause the woman's transverse abdominals to curl around the baby, lift the pelvic floor, and raise the baby into the rib cage, giving your baby a gentle hug. Helps calm babies in utero and cuts down the amount of pushing and pain during labor. Shorter pushing time during labor with less lower back pain. Helps minimize intra-abdominal pressure and can help minimize some of the negative effects of birth on the pelvic floor. Helps prevent diastasis recti and pelvic floor incontinence postpartum. Helps to maintain a connection to the deep core muscles throughout pregnancy, which are the pelvic floor, the transversus abdominis, and the multifidus. Decreases low back and pelvic pain as the deep core stabilizes the spine and pelvis. Decreases abdominal separation, creating space for the baby and maintaining the strength of the deep core muscles. Speeds up postpartum healing by creating core and pelvic floor stability. Helps get as much oxygen as possible into the body to help heal the tissues postpartum. Place one hand on the side of your ribs and the other hand on your belly. Inhale and expand into your hands. Feel the rib cage expand. Feel the pelvic floor expand. You may feel fullness in your perineum. And feel the abdomen expand outward. Next, exhale through pursed lips, creating an S sound, and contract your pelvic floor. Imagine picking up a blueberry with your vagina. Immediately followed by wrapping the abdominals around your midline. Engage your core and imagine wrapping your abdomen as if you were tightening a corset around your torso. Inhale to expand again, and let the pelvic floor and abdominal contractions subside, or imagine letting go of the blueberry. Keep the breath slow and controlled throughout the entire exercise. Repeat for 10 to 30 breath cycles. Apply the inhale, expand, exhale, engage practice to any movement to ensure your core is active and ready. Experiment with different cues and remember to use a cue every time you exhale to engage. It can turn almost any exercise into a core exercise. Add the TVA breath to your workout exercises. Perform throughout the day to create more balance and strength. Perform in the car, sitting at your desk, brushing your teeth, cooking, etc. In the weeks before birth, modify by inhaling to expand, then exhale and keep the expansion to mimic what you will do in labor. After your baby is born, restart the traditional TVA breath postpartum to help increase circulation and regenerate tone, strength, and function to your core. Thank you so much for watching. Now don't forget to head on over to hollybrownfit.com and subscribe for the latest in pregnancy, health, and fitness videos.